agree with Republicans behind this bill that Medicaid work requirements should be implemented as soon as 2026?
So the president wants to preserve and protect Medicaid for Americans who this program was intended for, the most vulnerable in our society, pregnant women, low-income families, seniors, those who truly need these benefits. And it should be going to people who physically cannot work. We want to see able-bodied Americans at least working 20 hours per week, whether that's part-time or full-time, whether that's even looking for work or volunteering for 20 hours a week if they are receiving Medicaid. These are common sense provisions. These are common sense changes that were actually introduced by former Democrat President Clinton. They've been supported by every Democrat president since, including the previous president, Joe Biden.
The Congressional Budget Office estimates that 7.6 million people will lose their health insurance if Republicans pass their big, beautiful bill. And you can bet your life the right-wingers will find a way to blame them for it.
You wrote a piece about Medicaid saying that there is a ton of waste in Medicaid. And you heard President Trump just moments ago. He said, we're not going to touch Social Security. But he said that there are a lot of bad people who shouldn't be on the list, something to that effect when it comes to Medicaid. What did you find and write about this week with regard to that?
The American people, the most generous people in the world. If you're hungry, we'll feed you. If you're homeless, we'll house you. If you're too poor to be sick, we'll pay for your doctor, but all of it's cost money. We're spending about $1 trillion a year on Medicaid. President Biden increased it by about 40%. We estimate that there are between 10 and 30 million people on Medicaid who are perfectly able to work. I've got a bill that says if you're between 18 and 55, you're not disabled, you don't have any minor kids at home, so we're not talking about a mother with a sick child in her arms, you've got to work 20 hours a week. That'll save us, according to CBO, about $100 billion over 10 years.
Right there.
It's not just about the money. There's a moral principle. If you can work, you should work. These programs were not meant to be parking lots. They were meant to be bridges. And for some people, not everybody on Medicaid, but for some people, the best way to get back on your feet is to get off your ass.
When you've got able-bodied males that have the ability to go out and seek employment in order to maybe secure health insurance to the private sector, that frees up dollars for disabled, for elderly, for women. So again, this is where my heart is.
Is that person able-bodied?
Sir,
that's my question, though. But Congressman, that's my question. Is that an able-bodied person? Someone who is in rehab dealing with addiction? I mean, would you consider that an able-bodied person?
The able-bodied person I'm talking about is the 25-year-old who's sitting on his couch playing Xbox.
And so you think there's just a ton of those?
That's the person that I feel like should. I don't know how many of them exist, but I know there is going to be a population that are getting that benefit when they really could be out in the workforce and securing it through the private sector.
Denying healthcare to anyone, for any reason, is dystopian. And yes, that includes even able-bodied men who occasionally play Xbox.
All right, we talk about austerity, doing more with less, but in that very same bill that is being worked on in the House right now, there are $235 billion in tax breaks for the top 0.2%. Do you think that makes sense when that same bill would throw 13 million people off of Medicaid? Should we give tax breaks to billionaires and throw kids and others off of Medicaid?
You're conflating the congressional bills with proposals from the president. The president
No, I'm talking about the congressional bill. I'm talking about the bill, the reconciliation bill.
I mean, the president is not trying to do tax cuts for billionaires. He's trying to have no tax on tips and no tax for
$235 billion by
how many billionaires do you know that are making overtime or making any part of the
$235 billion. Look, it's a big bill. There are a lot of provisions in it.
Many of the ways that they are designing these changes to Medicaid are based on changes in Georgia. Georgia has the third highest number of uninsured Americans in the country. Catastrophic. And that's with the so-called improvements from monthly reporting paperwork requirements to annual paperwork requirements. And so the Republican majority has looked at the state with the third highest number of uninsured Americans and said, that's what we want to model our Medicaid system after. This catastrophic failure. And I understand that the Republican majority wants the American public to be sold into accepting this by saying, you know what? We are secretly paying for Medicaid for every Venezuelan in the world, and that there are millions of 8-year-olds getting sex reassignment surgeries on Medicaid dime, and if we just take all of that, that will somehow make your Medicaid, cut that and make your Medicaid better. Sounds ridiculous because it is. And then they want to say, if you have $1 million house, right? Let's set this cap at $1 million. Okay, cool. I have a question though. I have another number that I think is interesting. Maybe what if you're getting a $22 million house, inheriting a $22 million house? Because what Republicans are saying is that if we make all of these cuts, we will then shift that and invest it into Medicaid for people who actually deserve it. But if that were true, then the top line number, our budget for Medicaid, would be staying the same, right? We'd be taking from undeserving people and giving it to deserving people, and that should even out. But that's not what's happening in this bill. This bill is cutting nearly $1 trillion in Medicaid spending overall. Why? Because down the hallway, they are trying to finance tax cuts for people who are inheriting $22 million houses. Because in 2017, Republicans and the Trump administration tried to increase the exemption of what you get a tax break on. If you used to inherit an $11 million house, you would get no taxes. You had no taxes on that in that estate tax. They said that's not enough. We need no taxes on a $22 million house.
Will the gentlelady yield?
Expired. I have to finish. That expires now. And it costs a lot of money to extend that tax break up to $22 million. So to pay for that, they are doing this. They are modeling and completely retrofitting the United States Medicaid system to model it after the state with the third most catastrophic uninsured American number in the country.
The Republican push to slash Medicaid isn't just a policy decision. It's a window into a deeply dystopian eugenicist worldview, one that sees disabled people as less than and therefore unworthy of care. This whole agenda is fueled by rhetoric that's dehumanizing and dangerous. From RFK Jr.'s fear-mongering about autism to right-wing media constantly painting neurodivergent people as threats to society, the message could not be clearer. If you're not productive in the narrowest, most capitalist sense, you're seen as a burden, a parasite, something to be managed or perhaps erased.
What would you tell people who want to cut Medicaid?
Medicaid is important for disabled and older adults because without that, we will be dead or in institutions, which we don't believe in. We need our independence and our autonomy. And we need to thrive and survive in this country. And we make up a sizable population. You think about your family, think about the children, think about all of the people that are affected by this and how it will change the trajectory of this country.
This is a photo of Philip, a resident of Haverhill, Massachusetts. Philip has a disability, but that hasn't stopped him from giving back, whether volunteering with Meals on Wheels, training service dogs, or caring for animals at a sanctuary. He does all this because of Medicaid. Medicaid funds the programs that help Philip gain skills, stay engaged, and remain independent. Medicaid isn't just a healthcare program, it's a foundation for independence for people with disabilities like Philip who want to live their lives with dignity. In Philip's case, Medicaid funds Opportunity Works and Community Works, a program that helps folks build job skills, engage in volunteer work, and participate meaningfully in society. These initiatives don't just keep Philip busy, they give him purpose. They help him grow, contribute to, and connect with his community. But here's why I'm telling Philip's story. This bill, This quote unquote big beautiful bill, as Donald Trump has described it, will slash the federal Medicaid funding that Phillip's program depends on.
Capitalism already reduces people to their labor output and tax bracket. But when you mix that with ableism and white supremacy, you get a worldview where disabled people, poor people, and really anyone that isn't white and neurotypical are treated as fundamentally disposable. If RFK Jr. cared about autistic people, as he's implied that he has for decades, he'd be fighting to continue and improve services to benefit their lives, not talking about them like they're a problem to be solved. Healthcare shouldn't be something that can be used to punish and shame people. It's not a reward, it's a right.